Hi, I'm Tanya Dorff, medical oncologist at City of Hope, specializing in genitourinary cancers. What I found interesting at ASCO 2021 with regards to prostate cancer was, of course, the plenary presentation of the VISION trial by Michael Morris and colleagues. This was a study in metastatic castration-resistant prostate cancer patients comparing lutetium 177 PSMA to best standard of care. There was a screening, a gallium-68 PSMA scan. However, most patients qualified. They did have PSMA avid lesions. About 13% couldn't enter the study because of lack of PSMA expression. But in the study population, there was a significant prolongation of overall survival, and we anticipate that this drug will become FDA approved since the survival benefit is very similar to that which we've seen with other life-extending therapies in MCRPC. And the toxicity profile is pretty moderate with not so much high-grade myelosuppression as one might worry about with a radiopharmaceutical, and dry mouth being one of the unique toxicities of the agent. A second abstract that was very interesting was the PEACE-1 trial presented by Karim Fizazi. This was a 2x2 factorial design in metastatic hormone-sensitive prostate cancer patients, looking at whether abiraterone improved progression-free and overall survival when added on top of prostate radiation or docetaxel chemotherapy. So initially, the study was not designed to look at the docetaxel question, but because the standard of care changed, the study design had to adapt. So it's a very complicated study design, a complicated analysis. What was presented was the rPFS endpoint, which was positive. We don't yet have the overall survival data, but essentially we saw that even if a newly diagnosed metastatic prostate cancer patient receives radiation in the prostate primary, they can still benefit from the addition of abiraterone. The other two abstracts that I thought were quite interesting included the SWOG S1216 trial, which was also in metastatic hormone-sensitive prostate cancer using TAK-700, which is a CYP17 inhibitor, so similar mechanism of action to abiraterone, but because of where it hits the pathway, there is still glucocorticoid production by the adrenal glands, and so we don't need to give prednisone with this agent. This study was positive for progression-free survival, as well as PSA nadir less than 0.2, which was a surrogate marker for survival in the Latitude study. However, overall survival did not meet the pre-specified statistical boundary. The hazard ratio was 0.86. And finally, there was a study showing how important it is to do PSA screening at an earlier age in African American patients.